Hi, I'm Kelly Fennell with Spire Wellness. This presentation is about preventive health and screenings and immunizations that you should have done with your physician. And at the very end, I'll tell you about how you can make some money by getting these done. Thanks. Today, we'll be talking about preventive health. So we'll go through kind of the scary stats and facts about kind of what's happening in our population today, some of the top health concerns. So, in America, what is killing us and what are, the top things we need to be worried about. We'll go over in detail some of the screenings that you can have done and what's the most appropriate for your age, along with what some of those tests tell us. So what's cholesterol, what's blood sugar, and where should you be? And then we'll talk a little bit about some warning signs of heart attacks and how that might differ for men and women, along with recommendations on how you can prevent these types of things for you and your family. So let's first talk about just where are we with health in the U.S. Unfortunately, we're not really in a great place. So over 70% of adults are diagnosed with chronic disease today, which is really scary. So that's majority of us will probably have a chronic disease at some point in our life. If you look at where hospitals and doctors are making their money, about 75% of those are considered to be a chronic disease that is actually preventable, and preventable both by screenings and then just our lifestyle behavior. When you look across those chronic diseases, cardiovascular disease, diabetes, hypertension, osteoporosis, anxiety, stress, a lot of those actually can be prevented, which is good news and bad news. The good news is that we can do something about that to make sure that we don't have those things. The bad news is that a lot of us aren't, living the lifestyle that we need to do to prevent that. So we'll talk more about that later. We have a lot of Americans that die every year from things that could be prevented, and heart disease is the leading cause, which again falls in that preventable category. If you look a little bit more into the statistics, about 44% of adults reported that they're consuming less than one fruit a day, which is really pretty sad. We need to be getting, 5+ fruits and vegetables per day. And about 30% of us don't eat enough vegetables either. For physical activity, 44% are getting the recommended, which is about 150 minutes of activity per week. So again, we have a lot of room to improve on that as well. And then you may have seen the statistic already, but about a third of our population is overweight, and about a third of that population is actually in the obese category, and that's all projected to increase. So again, just kind of scary, where we're, headed and kind of where the U.S. is on that. If we look at, what the top health concerns are, it's a little bit different for women and men. So the leading for both of those is heart disease. So you can see that's the number one killer for both men and women. But when you look down the list, women, are at risk of dying from breast cancer. They also have, top concerns of osteoporosis, depression, diabetes is on that list, and then other kind of reproductive health disorders. For men, they have a lot more, heart disease, stroke, lung cancer, and then also, injuries along with diabetes are kind of the top for them. So just things to keep in mind. Again, the good thing is that if we're going to the doctor regularly, if we're having our screenings done, if we understand what kind of lifestyle will help prevent this, a lot of these things can be prevented. So, like I've kind of been alluding to already, the fix is that you have more control over your body than you think you do. Even if you've got a family history of some of these things like heart disease or cancer, that doesn't mean that you have to get it. You actually can manage and completely avoid about 60 to 70% of the known chronic diseases. So again, that's really good news for us. A lot of it comes down to making sure that we have a relationship with our doctor, we're getting those preventative care, and that we're living a healthy lifestyle. For some of the screening guidelines, as you know, as we age, there are more and more things that we need to, make sure that we're checking out. It's kind of like taking care of a car or taking care of a house. You don't just drive it for 200,000 miles and expect that, you don't need to do any maintenance on it, or you never need to check the oil. It's one that you really, if you're checking it regularly, your car will last a lot longer, right? So you rotate the tires and, check under the hood every once in a while. It's very similar with, your body and doing the preventive screenings. So this chart just goes over some of those guidelines. The first chart is just in general what we need to have done. So the screening for cholesterol, LDL, triglyceride, that's a blood test. So we go in and just make sure that we're at low risk for heart-related, risk factors for, heart disease, stroke, dying of a heart attack, all of those things. So we can start that as early as 20. And so, every 5 years, as long as everything looks good. And then once we kind of hit the magical age of 40, we need to check it a little bit more often. So your doctor will probably suggest checking it more regularly, and then once a year kind of after the age of 50. EKGs, that usually happens. You might have heard of this maybe called a stress test, but this is something, again, that's going to check for your heart. It's more important as we age as well. So 40, sometimes we'll get a baseline so that we know if you're improving or staying the same or getting worse. But once you hit the age of 50, it'll be a little bit more regular. General physical exam, depending on your risk factors and your lifestyle. This is, when we're younger, we want to have done every couple of years. As we get older, we definitely want to have it done once a year. Immunizations, we'll go over that in a minute, specifically for that. Colonoscopy and rectal exam, again, this happens more when we hit that magical age of 50, that we want to go into our doctors and start having these done. Again, this is going to check for any cancers. It can check for polyps and things like that are happening in our colon. Again, these are things that we would never know about unless we went in and had the screenings done. And then the eye exam, when we're younger again, if our vision is good, every few years is good to go see. And then as you age, you want to go a little bit more regularly. If you're wearing glasses or contacts, you definitely want to go once a year. Now women, on this next chart, we have some other things that we need to do. So for us, even at a very young age, we want to do breast self-exams. Again, this is going to look for any of those signs that could lead to breast cancer. So we definitely want to take a look at that. If you have breast cancer that runs in your family, you absolutely want to do this on a regular basis. Now, a mammogram really isn't recommended until you get about to the age of 40. If it looks good at 40, they may tell you you don't need to have one done for a few years. And then once you turn 50, you pretty much need to have one done every year just to make sure. Pap smears, pelvic exams, those are things that we have done annually starting at the age of 20. And then bone density, we don't need to have a baseline until we're 60. Now men, on this next chart, you have a different set of screenings from the ladies. And for this one, it's going to be looking for prostate cancer and then any kind of issues that might be happening in your reproductive organs as well. So for prostate, that's also called a PSA test. This is actually a blood test. So this is something that's recommended when you hit the age of 50 to have this done on a regular basis to look for those cancer markers. Testicular self-exam, this is something that you should do on your own, even starting at the age of 20. The statistics for this is that most of the men that actually die from testicular cancer are younger men because they're not going to the doctor very regularly and they're not checking themselves. So those are the ones that are usually out of control and get to the point where, they may actually die from that. So it's definitely one to look on a regular basis for that. And then a digital rectal exam, your physician will do this, again, once you kind of get to that magical age of 50. Additional screenings that really could be for anyone, a skin self-exam. So this is just kind of being aware of what's happening on your body. So checking for moles, checking for rough patches, checking for maybe a cut or a scrape that isn't healing properly. Anything like that that's happening on your skin is something that you want to do on a regular basis when you're taking your shower. Have a loved one or someone, check your back because it's usually hard to see, but you can do those on your own. It's also good to have a skin exam done by your physician when you go in for your physical. HIV and STDs are something that you can also have screened on a regular basis. Glaucoma, You should have screened every couple of years when you're under 40, but then as you kind of get to that age of 50 again, you want to have it done more often for that glaucoma, just to make sure that your eyes are in a good spot and that there's not any extra pressure there. A lot of times this goes hand in hand with heart disease and high blood pressure. So if you have either of those risk factors, you absolutely want to get a glaucoma screening as well. Hepatitis B and C, again, depending on what you work with, those in the medical field are often asked to have those screenings done a little bit more frequently, but those are recommended as we age. Dental exams, you want to have done every 6 months if you can, but at least once a year, again, just to make sure that your teeth and gums are healthy. Actually, there are bacteria and diseases that we can carry in our mouth that if they're unchecked, they can actually travel to our heart and cause heart issues as well. So it doesn't seem like they would be linked, but having a healthy mouth that's checked by a dentist every year or so will definitely help prevent that as well. And then depending on what you do, if you're around a lot of loud noise, you may also want to have a hearing test. So kind of when you're younger, maybe every 10 years, but then again, once you're over 50, have it done every 3 years or so. When we look at immunizations, and there's I guess a lot of controversy sometimes about immunizations, to get them or not to get them, but really what the guidelines are from the government and the medical association together is that these are the immunizations that you should be getting. So flu, you can have done every year if you like it. If you're one that's not really working around a lot of people or you don't have a lot of exposure to flu, maybe you can skip it. But if you've ever had the flu, then I would like to avoid that most of the time. So you can get that annually for everyone that's 6 months and older. Hepatitis A and B, usually you're getting those kind of in your, when you're in your late teens or 20s, but those are definitely ones that you have to have done a couple of times. If you've never had a vaccine for that, you can ask your doctor about it and see if they can get you started on those. The herpes zoster you can have at 60 plus. This just helps prevent shingles. So shingles is something that you can be prone to as you age, and it's usually a virus that's just kind of laying dormant in most of us. If you've ever had chickenpox or any other herpes virus, those viruses can lay dormant in us, and then as we age, they can turn into shingles. So the herpes zoster immunization helps us, kind of stay at low risk for that developing. For meningitis and pneumonia, again, those can be done kind of as we age. A lot of times, young adults will get the meningitis immunization, and it just protects against mono or other meningitis conditions. Pneumonia, we really don't need until we're 65 plus. Again, that as we age, we just can't fight pneumonia as well as when we're younger, so we want to make sure that we're protecting ourselves so that doesn't turn into a bigger issue. Tetanus, you need to have done about every 10 years. If you don't know when you've had one done, you can ask your physician, or you can just have one done and then have them mark your charts. Usually if you, get scratched by something that's rusty, or, you step on a nail or something, they'll go ahead and do one anyway, but we definitely want to keep up with that. So let's talk now a little bit more about some of the biomarkers. So one of the screenings that we talked about was making sure that we get our blood work done and a physical, every couple of years when we're younger or every year as we get older. And some of those things that they'll look for, we'll talk now. So BMI is one of those, and this really has to do with our height and weight, and is our weight appropriate for how tall we are. So BMI is an index. It really is just kind of a marker for whether or not we're in a high risk category. So if our BMI is less than 25%, then we usually say that it falls within normal. There is a BMI that's too low, and that's when you get past or under the 18.5, and that might mean that we're actually underweight for our height. But most of us are falling into the category where we're over 30, which means that we're kind of in that overweight category, and then 30 or higher is in the obese. So We want to try to stay under 25 if we can. It just means we're at the lowest risk for getting heart disease, stroke, and some of those other chronic conditions. So for example, you can see here for a person that's 5'9", if they weigh 124 pounds or less, then they're actually underweight. If they're 125 to 168, they're a healthy weight. If they're above 168 pounds, then they're overweight. And if they're over 203 pounds, then they're actually obese. So this just kind of shows you an example of what it would look like for someone who's 5 feet and 9 inches. Your doctor can talk to you more about this if you go in and have a screening done. There's also another way to measure your weight, and that's with a body fat percentage. And this just means it looks at your body and analyzes how much of your body is made up of fatty tissue and how much of it is made up of lean mass. So again, a doctor might use this instead of the BMI. Both of them are good measures. And again, we're just looking, for those risk factors for, other chronic conditions. Another one you might have heard of is cholesterol. So cholesterol is just a waxy substance that's in our body. Our body actually makes its own cholesterol, and then we can actually eat cholesterol as well. So if you've ever, seen on maybe a label how much cholesterol is in a food product, or you've heard that, bacon has a lot of cholesterol or shrimp has a lot of cholesterol, we can actually eat it, but our body can make it itself. There's different kinds of cholesterol. So on our labs, there's something called a total cholesterol. This is just really the marker of all the cholesterol in our system. LDL is considered the bad cholesterol, so it's the stickier cholesterol that makes up the plaques and the wax and kind of sticks to our arteries and veins and causes the problems. HDL is actually a good type of cholesterol, so this cholesterol actually kind of goes through and kind of scrubs out the system. So if you're going to have a higher total cholesterol, you actually want a lot of good cholesterol in there as well. That kind of make sure that, okay, yes, I have a lot of the substance in my arteries, but it's kind of being cleaned out and scrubbed by the good HDL. So in the chart here, you can kind of see what's desirable and what is high or low for those. But that's just a little bit more about what cholesterol is. Again, if you have high cholesterol, it's one that, it does put you at higher risk for any kind of cardiovascular, diseases like having a heart attack and even having a stroke. Blood pressure is another one that your doctor often takes when you get your screenings done and once you get your physical done. There are different ranges for this as well. So what's recommended is to be less than 120 over 80. So what that means is that the pressure in your veins is low enough that it's not going to cause any problems. What happens is when the pressure gets higher, it's just like putting high pressure through a hose or a pipe. It will look for the weak spots and it may bust. And so that's what we're looking for in trying to make sure that your blood pressure is low enough to not cause any issues. If the pressure is too high and something did bust or break, then that's when we could have a stroke, we could have an aneurysm, we can have other issues inside our body. So again, this chart just kind of walks through what those look like. Again, as Americans, we really struggle with high blood pressure. One, because stress can cause it. Two, because salt plays a big part, and we like a lot of salty foods. So we really want to watch this. And really, there's not a lot of warning signs with high blood pressure. That's why they call it the silent killer sometimes, because you don't really know that you have it often. So it's good to have it checked. Often you can check it in your doctor's office. You can also check it at Walmart or CVS or Walgreens. A lot of times they'll have a blood pressure machine there as well. When we look through warning signs of a heart attack, what we see is that women and men actually have different signs sometimes. So a lot of times, you hear that, oh, you might feel a squeezing in your chest or pain radiating down your arm. And that can often be the case, but this chart just shows that it might feel a little bit different for men and women. So it's good to know these just for your own risk, but also for a loved one. So maybe your spouse or your parent is saying, complaining of something, or they're not feeling quite right. sometimes knowing these warning signs can be good for you so that you can get them the care that they need in enough time. So for women, sometimes they might have lightheadedness or dizziness. That's not normal. They might actually have upper back pressure, so sometimes we just feel that pain in a little different spot. Certainly chest pressure might be there, shortness of breath. They may actually faint or, just kind of feel really tired. A lot of times people will complain of that, just waking up in the morning and instead of feeling ready to go, they're really feeling quite ill. For men, they could have cold sweats. They may have a little bit more chest pressure or pain, shortness of breath, and then pain in one or both of the arms. So they're a little bit more of what we would consider our classic symptoms. Women sometimes have those other symptoms as well. Okay, now we'll flip in and talk a little bit more about blood sugar. So blood sugar is important because it's a risk factor for diabetes. Again, we want to have this checked fairly often. The statistics is that about 1 in 4 people will have diabetes at some point in their life, and so it's one that we all need to make sure that we're, watching for the signs and symptoms, but that we're having our blood sugar checked regularly. And there's a couple of different ways to have your blood pressure checked. Most of the time, it's either a finger stick or a blood draw that your doctor does. Sometimes if you go to a health fair or other, health events, they may actually, stick your finger and give you a blood sugar test. But there's fasting blood sugar, which just means that you haven't eaten anything or put anything in your body for 8 to 12 hours. And that's a really good indicator to see how your body is handling the sugar that you're taking in. So you should have a very low blood sugar if you haven't eaten anything. People may also test your blood sugar right after you've eaten. So again, the marker there is trying to see whether or not that your body is processing sugar the way that it's supposed to. So if your body is really, let's say you drink a glass of orange juice, which has a lot of sugar in it, if your body really spikes up very, very high, that might mean that your body's not handling it very well, where a healthy body with healthy tissues, it will certainly increase, but it's not going to spike super high. So they will check any of those, and you can see in this little chart where you should be. So a normal blood sugar for fasting would be anything less than 100. After eating, you want to be under 200, and then 2 to 3 hours after eating, which your body really should self-regulate itself, you should be closer to that 100 again. A lot of us may be in that kind of impaired glucose range, which means that our body and our tissues just are, not as reactive to the blood sugar as it's supposed to be. So if I eat a donut, my body isn't processing that sugar as fast as it should. And when sugar hangs around in our blood system, it can create a lot of, havoc and high risk for us. So it can kind of scratch our blood vessels, which makes plaque build up faster. It can also kind of stimulate the growth of cancers and other things. So we just don't want a lot of sugar in our body. It can create a lot of problems, and also, with the way we produce hormones and other things as well. And then in the red zone there, you can see the diabetic range, which means that you absolutely are impaired. So that is for fasting, anything above a 126. After eating, you're kind of close to that 300 range, or 200 kind of most of the day. So again, that's kind of that danger zone. If you have ever had your blood sugar tested and you're in those ranges, it's definitely something to talk to your doctor about. Now, another way to test our blood sugar is called hemoglobin A1C. What this is it's a marker in our bloodstream. So it's actually like a little protein that our body makes when it's been exposed to blood sugar. And what this marker shows us is over the past 3 months, how has our blood sugar been? So if our hemoglobin A1C, or it's also just called an A1C if you've ever heard that talked about before, if it is lower, what that means is over the past 3 months that your blood sugar is regulating itself the way it's supposed to be. This little marker or this little protein isn't showing up in our blood, and that means that our body's doing what it's supposed to. Now, if we kind of get into the good or the high ranges, so basically anything kind of above a 6, that means that over the past 3 months, our blood sugar isn't being as regulated as good as it should be. So instead of checking one point in time, this checks over a long range, and sometimes that can be a better indicator. So if you are diabetic already or you're pre-diabetic already, your doctor's probably checking your A1C to see basically how well you're regulating it. So again, we want this to be as low as possible. It just means that your blood sugar is in a good range. So now let's flip into talking a little bit more about what we can do to prevent these things. Clearly, it's good to go out and have your screenings, but what can we do in the meantime to make sure that all of these biomarkers and that when we go have the screenings done, that they're telling us good news and not bad news? So one of those things would be to eat more, and I'm not just saying eat more of everything, but eat more fruits and vegetables. So we really, what evidence is showing us and what studies are showing us is the more, fruits and vegetables that we can get on our plate, the better off we're going to be. There's a lot of vitamins in there. There's a lot of really good nutrition for not a lot of calories, which is what we're looking for. So a lot of fiber, a lot of those good things that are going to keep the cholesterol down, keep our blood pressure low, keep our blood sugar low. So if you can get raw fruits and vegetables in your diet or cooked fruits and vegetables in your diet, basically anything is really going to help with that. And oftentimes if we have a salad like before we have our dinner, a lot of times that will kind of fill us up a little bit so we don't have as much room for, some of the things that maybe aren't as healthy in our diet as well. So what's recommended is for us to have at least 5 portions of fruits and vegetables a day. We want to also limit our sugar as well. So ideally what we should stay is under 50 grams. So if you go in and look on your food labels and see how many grams are in like on your soda or in a candy bar and things like that, oftentimes that'll be 25 grams of sugar. And so that's half of the sugar that you should have for the day. So if you had 2 regular Cokes and you're already at 50 grams, then that is all you should be having. What's tough is that in a lot of our foods, there's more sugar than we think there is. So reading labels can be a really good thing for us. And then also limiting our intake of, fat, especially the trans fats and, the unnatural fats, if you will. So anything that's coming from oil or those kind of fatty substances is not necessarily a great thing. We don't have to be 100% fat-free, but the lower we can get in that, and if we're getting most of our fats from, vegetables like avocados and coconuts and things like that, bananas, like all of those have some natural fats in it, and that's definitely a better fat to go than with things like, lard or fat on meat, things like that. Also, to help prevent with blood pressure, we want to make sure, like I said earlier, that we're watching our salt intake. So here are just some examples of things that you can do to avoid getting extra salt in our system. What happens with salt is that water follows salt. So if we're eating a lot of salty foods, our body actually will retain that water. You might feel that sometimes if you've, eaten a lot of, let's say salty chips or something like that, you might feel like your fingers, you can't move them as well. They might feel really tight, or you feel a little bit more bloated. That's because your body is hanging on to all that water. And that actually makes your blood pressure higher. So just want to be really careful with that. So you can choose lower sodium items. You can limit eating out and limit processed foods. They actually put a lot of salt in processed foods because they want to make it taste better. So they'll put a lot of salt in there, and salt actually works as a preservative as well. So a lot of that has a lot of salt in it. Canned soups and things like that can tend to have a lot of salt. So just try to read your labels, and certainly try not to add a lot of salt to your food. If you have a salt shaker on the table, maybe put it in a cabinet or hide it away. Also think about what you're drinking. Like I just gave an example of with the sugar, there's a lot of hidden sugars in some of the drinks, even juices and things that are natural, smoothies and things like that. There can still be a lot of sugar in there. If you can take in more water, that definitely is the best way to go. So again, this little chart is just giving some good reasons to drink more water throughout the day. The recommendation, I know a lot of us, hear that it's like 8 glasses of water a day, which is wonderful if you can do it, but, let thirst be your guide and, really try to take in as much water as, you feel like you can during the day. But a good rule of thumb is to have, about 11 small cups, if you will, per day for women and about 15 for men. So that's really close to that, 8 full glasses, but might be a little bit less for some of us. Physical activity is another good way to stay at low risk for some of these items. So when you're moving your body more, your body processes cholesterol, it processes fat, it processes sugar a lot differently than if we're sitting all day or being inactive. So again, the more we can move our body and the more we can, keep our muscles strong, it helps with our body chemistry. And so we really want to make sure that we're getting exercises. It also has a lot of positive effects on our mood, depression, anxiety, and keeping our weight down as well. So again, just some reasons to exercise. And if you can get about 150 minutes in per week, that's what's recommended. And then our very last slide is just to remind you that you actually have an incentive and a way to earn some extra cash in your pocket by having your screenings done. So again, we kind of talked through what screenings should be done. At MANR, they're actually offering you some time to go see your doctor, and also $50 if you complete and fill out your form and turn it in. And this is just so you can have some of these screenings done with your physician, so that if anything is found, then they can address it immediately, and you can make sure that you're staying at low risk and that you're not prone to having any of these chronic diseases. So again, just encouraging you to go out and have your screening done. If you get them turned in to Spire, then we will make sure that you get those $50 come back into your paycheck. If you have any questions, you can go to your HR. They have the forms. They can tell you more about how to get them done. But I hope that you can go have your physical done this year if you haven't already. And I wish you the best. Thank you for having me.